Everybody, Dr. Cohen here. And this morning I was working with a patient that is struggling with some IT band issues. And she's a runner, and like a lot of runners, she's having that annoying discomfort on the outside of her thigh that can sometimes be present also in the lateral aspect of the knee as well, right where the IT band is. And like a lot of those folks, she's trying to address it by doing foam rolling and by stretching the area. And unfortunately, this isn't the most effective approach, and here's why. Our IT band is a piece of fascia, a piece of connective tissue that connects to a lot of different areas, most notably our tensor fascia lata muscle and our glute max muscle and our glute medius up around the hip, and then connects right around the lateral aspect of the knee. And this muscle is fascia, it's connective tissue, so it doesn't behave like a muscle does. Where a muscle, we can sometimes foam roll it or stretch it, and that can help make it feel better. But IT band, not so much. Actually, when we looked at cadavers when we were in school, we would always see just how thick and tough this band of tissue was. And I can tell you, there is no way we are going to be creating any tissue adaptations with a foam roller or some stretch that you can do. And so what we really have to look at are the muscles that attach to the IT band itself that I mentioned earlier, the tensor fascia lata, the glutes. And if we can impact how those muscles are influencing the position of your IT band, well, perhaps it's not going to become as irritated when we're doing those repetitive actions like running, for instance. So one of the first things we have to look at is just how well are your hips moving? If we're not able to move through a full range of motion throughout the hips, well, that's going to impact the muscles that then attach to the IT band itself, because those muscles, if they're not working with a joint that can really move well, they're not going to be moving through the full range of motion they could become stiff, they could be under some tension, or just not be able to function in the ways that they would really like to. Then, of course, we have to look at the strength of those muscles. Are they able to just counteract the pull from the other one? What I mean by that is perhaps your tensor fascia lata muscle in the front of the hip is pulling a little bit more than the glute on the back half. So you got one thing pulling from one side a little bit more, one thing pulling from the other side a little bit less, and that can bias the position of how our IT band is sitting, creating problems when we move. And in addition to that, what is the position that we tend to utilize when we move in regards to our pelvis and our rib cage on top of one another? Because a lot of people, if we tend to hang out in this overly extended, anteriorly oriented pelvis position, that is going to impact the tension or the position of the muscles themselves that attach to that area. The tensor fascia lata muscle, the glutes, all those things we talked about earlier, therefore impacting, again, how it is creating tension on the IT band itself. And then, of course, how are we moving? What do our movement strategies, our movement patterns look like? Are we squatting or hinging or landing or running in different and funny ways that may be putting more stress on the IT band than maybe it needs to? Those are all things we can address. So if you're somebody out there and you've been struggling with IT band issues, I'd really suggest that you get somebody to assess things. See where your limitations may be. Do you have any range of motion restrictions? Are there any glaring strength issues that we need to address? Perhaps you're using certain movement strategies that might not be as optimal as they could be to take some stress off of that IT band. Whatever the case may be, and perhaps even take a look at your running technique and things like that. All those are different factors that can cause stress to accumulate over time on your IT band. And if that's something you're interested in getting looked at, getting addressed, come see us. We can certainly do that and then be able to give you a program to go ahead and get rid of that issue once and for all.